Hi everyone, myself Dr. Kirti here. Welcome to Pathology4 channel. Why do you think EBV create the famous ballerina skirt cell? And how does one tiny virus lead to Burkitt lymphoma? Let's decode the EBV like a story. So first, how does a virus enter our body? EBV enters through saliva, first reaches the throat, then searches for its favorite target, that is nothing but our B lymphocytes. Why they are choosing B lymphocytes? Because EBV has a key called as a glycoprotein 350, which perfectly fits the B cell receptor CD21. So once this GP350 and CD21 bind, just like that, the virus enters the B cell. So next, the virus takes the control. Now the EBV tells the B cell, don't die, keep growing. The virus activates a survival pathways using its famous protein, that is nothing but your LMP1. So it's like a fake CD40 signal. It continuously activates NFKB and your JAK-STAT anti-apoptotic pathway. So now the B cell survives and proliferate endlessly. EBV basically turns the B cell immortal. That's what they are trying to say. So the immune system attacks now, but the body notices something suspicious. So now enter the heroes, that is nothing but our CD8 T cells. These cytotoxic T cells attack the infected B cells aggressively. And these activated T cells are what we actually see in the peripheral smear. That is nothing but our reactive lymphocyte, which is our infected B cells. Okay, so they are activated T cells. That's nothing but now comes the beautiful pathology finding. The RBC surrounding the atypical lymphocytes, these are reactive lymphocyte, which will be large, deeply basophilic, vacuolated, scalloped at margins, and the cytoplasm hugs surrounding the RBCs show the ballerina emoji. So that is a key giving the famous ballerina skirt appearance. So when the T cell dances around the RBCs, pathologists call it ballerina skirt. So remember this point, don't forget about it. It will be deep blue, abundant cytoplasm, clear vacuoles, scalloped and indented margins will be there. The indentation by the surrounding RBCs gives the appearance of ballerina skirt with a large vesicular nucleus. So what will be the clinical features now? The patient present with a fever, pharyngitis and lymphadenopathy. Okay, along with fatigue, hepatosplenomegaly and atypical lymphocytes will be seen on our peripheral smear. So next one is spleen become enlarged because it's overloaded with immune cells. So the trauma can rupture the spleen. So avoid contact sports. That's what they're trying to say. So let us move on to the dark side of EBV. That is, EBV does not always leave. Sometimes it hides silently beside our B cells, and over time genetic hits occur. So that is where